Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron nang umuumbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not a either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really, like Simply Nature, that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
Napansin ng pedyan niya na maputla compared noong bagong silang kasi monthly na nagpapa-follow up kami. Maputla at saka medyo distended na yung kanyang abdomen. From then, doon kami nag-start ng workup like blood test, ultrasound, hanggang ma-CT scan and ma-work up sa hospital. Doon na na-diagnose na meron siyang stage 3 na yung kanyang tumor sa liver. When she started taking PPARs noong September 25, we decided na i-try at i-monitor siya within a month. So, within a month, after 1 month, October 25, nagpa-blood test and ultrasound kami. And we really thank God na there is a big improvement. For me, it's really a blessing yung PPARs because yung dating alpha-fetoprotein niya na tumor marker ng liver cancer, which is 65, it went down to 14. So, almost 4 times yung kanyang binaba na from 65 to 14. At ang kanyang ultrasound din, lumiit din yung kanyang lesion. Before siya nag-take ng PPARs, it was 3.6 by 4 by 3.5 centimeters. After 1 month lang, malaki din para sa amin yung binaba niya na naging 3.1 by 2.8 by 2.7. So almost 1 lahat yung 1 centimeter, yung 1 centimeter kahit 1 centimeter lang yun, malaki na yun na pagbabago kasi 1 month pa naman eh. So, aside from sa pag-decrease ng kanyang lesion, meron din kasing nakitang nodule sa kanyang spleen that measures 1.7 by 1.9 by 2 centimeters. After 1 month na sa pag-ultrasound niya, it's miracle for us because it's totally gone. It totally disappeared. So, we are thankful, forever thankful for leading us to PPARS kasi we believe na ginamit ni Lord yung PPARS to help us na hindi mag-undergo ng surgery yung baby namin.
That study between cisplatin and PPAR combination clearly shows how PPAR can improve the results of chemotherapy and immunotherapy combined. Because PPAR can protect the bone marrow. So it is the bone marrow where blood cells like our immune cells, immune cells are being developed and produced. So with the protection given to the bone marrow, the immunotherapy will work better.
Hi everyone, welcome to another episode of Simply Healed, and today we have a very special guest, which is our oncological surgeon, Dr. Jimmy.
Hi Sir Sean, and hi everyone.
And today's topic is about lung cancer. So it's really interesting because today we have Dr. Jimmy with us, and he's an oncological surgeon. So, but Dr. Jimmy is also prescribing and administering chemotherapy, so it's so nice to have an oncology focused perspective on our program today. And Dr. Jimmy actually prescribes, you administer chemotherapy at Manila Medical City, right?
Actually, I do surgery most of the time, but I can also give chemotherapy.
So this is a great time to ask questions with regards to chemotherapy and surgery. But back to the original topic. Doc, lung cancer. How common is lung cancer in Philippines?
In the Philippines, lung cancer is the #1 cause of cancer among males.
Among males? Wow, I thought it would be colon or prostate cancer, but lung cancer is very high. And Doc, lung cancer is something to be concerned about. Am I right?
Because it's deadly.
How deadly is lung cancer actually?
Actually, the 5-year survival of lung cancer depends on the histology. We have 2 types of lung cancer. We have the non-small cell lung cancer and the small cell lung cancer. For the non-small cell lung cancer, the 5-year survival rate is only 26%.
Wow, 26%.
Yes. But for small cell lung cancer, the 5-year survival rate is lower. It's only 7%.
7%. Those are very difficult odds. So it's so important, Doctor, to discover lung cancer early. Is it easy or difficult to discover lung cancer early?
It's actually difficult because most of the time, patient will only have symptoms of hoarseness, a little chest pain, mild chest pain, sometimes a weight loss or recurring cough.
And then those are very like normal symptoms for like flu or even general
They will just
fatigue.
consider it as a flu symptom or sometimes irritation.
So they will ignore it.
Yes, they will dismiss it as just a simple pulmonary manifestation.
Will early stages of lung cancer, like stage 1 and stage 2, where it's more treatable, will it actually appear on, let's say, an X-ray of your lungs?
Sometimes, but sometimes it will not.
Okay, sometimes it will not.
Yes.
So it's not a sure way to discover your lung cancer.
Because chest X-ray can only detect tumors maybe as big as at least 1 to 2 centimeters. But if it's smaller than that, it will not detect the tumor.
So if a tumor if you have lung cancer tumors in your lungs and it's already 1 centimeter, rough gauge, what would you say that stage will be already?
It still depends if there's a
Spread.
to the lymph nodes, the regional lymph nodes, as well as to the other parts of the body. But if it's only the tumor, it's only stage 1.
Okay, so there's still a good chance. And one of the common causes of lung cancer is basically air pollution, and the number one cause is smoking,
Yes.
including secondhand smoke.
Yes, 80% of lung cancer is related to heavy smoking. The remaining 20% is related to pollution, like diesel fumes, secondhand smoke, as well as radon and asbestos.
And Dr. Jimmy had advised me earlier, because I'm approaching that age, which is 50, okay? For those who are above 50 years old and you are a heavy smoker, or you've been working in an industry where you really breathe in a lot of these air pollutants, right? Then Dr. Jimmy suggests that you can consider having a CT scan, an annual CT scan. That of course is in combination with if you have some
Especially if you have symptoms.
So again, if you're over 50 years old, you're a heavy smoker, you work in a polluting industry, and you have some of these symptoms, do consider going for more than an X-ray for your regular checkup. You might ask your doctor if you are advisable to go for a CT scan. Alright? And if you're not sure and you don't know which doctor to go to, just give us a call, put a note right now, then you can always come and consult Dr. Jimmy, who will be able to help you decide whether you should go for a CT scan, and definitely be ready to help you in any treatment if the scans come out positive. So Doc, when it comes to the treatment of lung cancer, what is the most common treatment? Is surgery even common in lung cancer?
There are many treatment modalities for lung cancer. For early stage lung cancer, they can undergo surgery. So for more advanced lung cancers, the treatment options are radiotherapy, chemotherapy. We also have immunotherapy and targeted therapy. And I will also add palliative therapy, especially for those, let's say, very advanced or terminal cases of lung cancer.
I think this is important to note that treatment of cancer is also about quality of life. Yeah, and that it's not only just about treating a cancer, and difficult as it may be. Lung cancer is a very aggressive cancer, and sometimes the prognosis is not pleasant. Not pleasant. Am I right? I was under the impression that late stage lung cancer, by the time you see your doctor, and if it's stage 4, 5 to 6 months is not unreasonable.
Actually, we tell them the average life expectancy, especially with stage 4 and with severe symptoms already, around 6 months, 6 to 12 months.
So at that point, for those of you who have family members that are in that very difficult position, not all options is lost, right? We still go for treatment, and you should consider palliative treatment. Yes, to
improve the
ensure
quality of life, and also sometimes it can lengthen the lifespan of the patient.
All right. Okay, Doc. Let's go to positive treatment of lung cancer. So chemotherapy. What are the common classes of chemotherapy drugs when used for lung cancer?
Okay, the most common chemotherapeutic agent used for lung cancer are the platinum-based agents like cisplatin or carboplatin. But there are also other agents like the toxins and the likes.
Now this, you guys may not know, but it's very important to know because of all the chemotherapy agents. Simply Nature PPARS has actually been tested on platinum-based chemotherapy drugs. Specifically, we've tested it on cisplatin and also oxaliplatin. But the main trial was on cisplatin, which is exactly the drug that Dr. Jimmy had just shared. And the result was that we protected the bone marrow from the chemo toxicity. So that means all the negative side effects we are concerned about for chemotherapy drugs. Well, if it's platinum-based like cisplatin, we actually tested our liquid extracts on it, and it did amazingly to protect the bone marrow. And that is going to be very important for the next type of treatment, which is Immunotherapy. Doc, maybe you could share with us in simple understanding, how does immunotherapy work? Is it like chemotherapy where it attacks the cancer cells directly?
No, actually, immunotherapy works indirectly. It doesn't attack the cancer cells on its own. It actually strengthens or boosts the immune system of the body for it to develop, to increase its capacity to kill the cancer cells.
Doc, in that case, it's also common that immunotherapy is always, not always, very often combined with chemotherapy.
Yes, it can be given together with chemotherapy.
So many times we will give chemotherapy first because, okay, if a patient is going for immunotherapy, why would they have to do chemotherapy?
Because of the different mechanism of actions. So they actually work synergistically. One is to attack all the rapidly dividing cells. That's for the chemotherapy. No? To attack the rapidly dividing cells, but it will not discriminate between the cancer cells and the other rapidly dividing cells of the body. So chemotherapy can also affect the normal cells of the body. On the other hand, immunotherapy will act on the immune system of the patient to boost its capacity to develop like the T helper cells to increase the capacity of our own immune system to attack the cancer cells.
So there you have it. Even though there is immunotherapy which has less side effects than chemotherapy, chemotherapy is still very effective because it's a direct hammer. It's like me punching you and Pacquiao punching you. Very different impact, right? So, Doc, it seems to me that chemotherapy's action is a little bit in direct opposition to the immunotherapy because, as you mentioned, chemotherapy also damages the body's healthy, rapidly dividing cells. So, would you say that Simply Nature PPARs is like a perfect combination, especially for cisplatin, because we actually protect the bone marrow and everything that's important to the immune system, so that when you finish your chemotherapy and you start your immunotherapy, your effect of the immunotherapy will be better because your immune system is intact?
Yes, I think that study between cisplatin and PPAR combination really shows how PPAR can improve the results of chemotherapy and immunotherapy combined, because PPAR can protect the bone marrow. So it is the bone marrow where blood cells like our immune cells, immune cells are being developed and produced. So with the protection given to the bone marrow, the immunotherapy will work better.
Wow, that's a very good technical medical insight. So now you know that you can get more bang out of your buck, you get better results for your chemotherapy and immunotherapy if you will take additional steps. Like for example, taking Simply Nature PPARs to protect your immune system during the chemotherapy phase, especially during the chemotherapy phase. So again, I can see there are many questions coming up that everybody's probably asking about chemotherapy. Common question, do they really have to take chemotherapy? Can they avoid chemotherapy? You know, this is why we're very happy to have Dr. Jimmy. Wow. So, you know, there is never a doubt, you know, in any doctor's mind, even a naturopathic doctor, you know, they will always have to concede chemotherapy works to kill the cancer cells. It's just that some patients, actually a lot of patients have varying degrees of side effects, and some are so strong that they can't take it. But it doesn't change the fact that chemotherapy is very effective in killing cancer cells. Now, as you can see, we can solve the side effect issues, minimize it, so you can be brave, you don't have to be afraid. You can go for a chemotherapy and do well. That means that you are the best, most aggressive weapon, I guess. You can use the most aggressive weapon, which is your chemotherapy on your cancer, and still be well, be fine, because there'll be Simply Nature PPARs to protect you from the side effects. Alright, so I can see, yeah, a lot of questions are coming. So, Doc, any last advice for our viewers out there, especially anything about cancer? Yeah.
I think since we're talking about lung cancer, my advice would be for those who are heavy smokers. Yes, especially those who are 50 years old and above. If you are feeling any symptoms of prolonged cough, chest pain or chest heaviness, consult a doctor. So you might not know what you have, no? So, and also for those who you have symptoms, even if you're not 50-year-old, especially if you're exposed to very high pollution areas, you have to consult a doctor so that you can be diagnosed properly and be treated accordingly.
So if you're above 50, as Dr. Jimmy said, you have some of these symptoms, don't be so casual about it. It can be simply solved by going for a more comprehensive diagnosis like CT scan. Alright, then at least you have a peace of mind. Alright, so with that, let's go to our next segment, which is the Ask Me Anything segment of our program today.
Good evening, everyone. My name is Sheila, your healthcare specialist in Simply. Thank you so much for watching our webinar, our special webinar for tonight, because this is the first time, all right, that we are doing our webinar simulcast in YouTube, not only in Facebook. And one more thing, because we are now in the Q&A or the AMA, or Ask Me Anything portion. We are not only having one expert, not two experts, but three experts for tonight. So without further ado, to answer all our questions tonight, I'd like to call on first our CEO of Simply Nature, Mr. Sean Lim, followed by our surgical oncologist, Dr. Jimmy Catapia, and of course, our lifestyle medicine doctor, Dr. Jansen Tancalalang. Good evening, gentlemen.
Good evening, everybody. Big welcome to Dr. Jimmy for joining us. I think this is one of his first or second live Q&A, so big hand to Dr. Jimmy, and of course our regular anchor and in the studio with me, all right, Dr. Johnson. All right, so Doc, you want to say hi to everybody?
Yeah, hello everyone. Good evening to everyone. No, so today we're actually doing two simultaneous live webcasts, no, in Facebook and YouTube. So yeah, you can go to any platform that is fast enough. So I hope you learned a lot in Dr. Jimmy's discussion about lung cancer tonight, no? So yeah, we're ready for your questions, and I already see actually a lot of questions coming in already. So yeah, let's begin.
Thank you, doctors. All right, I just want to let you know the registries that we have tonight are coming from Singapore, Malaysia, Brunei, and of course, I'm here.
Wow, so we have audience from all over Southeast Asia.
Thanks so much for watching
Yeah,
and for joining
wonderful.
us. All right.
I want to do a special shout out to our audience from Malaysia. It's a growing audience, so I want to thank my neighbors for supporting me because I'm Singaporean, right? So big thank you and welcome to our Malaysian viewers. Yeah.
Happy we're here. All right, coming from Mr. Arnold Padilla, may I ask, is there already an effect? Because my wife is already taking PPARs, and I have observed that she's not losing appetite and she's not getting weaker. However, she mentioned that she is still having pain in her back, and she is still taking tramadol as pain relief.
What's her condition?
I think it's also cancer. Yes, I think you have to follow up on that with the exact stage 4 lung cancer.
Oh, stage 4 lung cancer. Wow. Would either Dr. Jimmy and Dr. Johnson have any experience that you want to make a comment?
I think let's ask Doc Jimmy first.
Yeah, Doc Jimmy, you want to comment before I comment?
I think this is since this is a stage 4 lung cancer, I think the patient also has probably a bone metastasis because of the persistent back pain. Or unless the primary lung tumor is also invading part of the posterior mediastinal area, part of the back at the chest, the chest area causing the pain. So PPAR can also lessen the pain of the patient since it affects inflammatory cascade of the patient. So aside from the anti-cancer effect that it can cause, it can also alleviate some form of pain. But of course, you still have to take the usual tramadol, and if tramadol is not anymore effective, you can try other non-steroidal medications. And sometimes you have to really take also the opioids like morphine.
In addition to what Dr. Jimmy has shared, I just wanted to also highlight to the patient because many times cancer patients, when you use protocols, you are looking for like total cure, total everything is all right. But you know, when you're dealing with very serious conditions like 4th stage lung cancer, just to have your appetite is something that you should be encouraged with already. So what I want to say is to all cancer patients, especially the ones who have serious cancer, when you see a positive, focus on the positive, because honestly at 4th stage, it should be very painful, you should be very weak and everything. So the fact that you are having good appetite, good energy, focus on that and give yourself encouragement. It means that you are doing better than what is expected of a 4th stage lung cancer patient, and hopefully that means that you have a good a brighter future ahead. Yeah.
So I totally agree with Dr. Jimmy and Shan here, no? So at this point in your cancer journey, okay, since we are tackling stage 4 lung cancer already, so the primary goal here is quality of life already. Okay, so if you have good appetite, you're alert, active, you're not feeling weak, although there is pain, of course. So that pain might be, it's always there, so that would be really very uncomfortable. But with tramadol, if it's responding, then good. But if it's not, then you might have to consult so that we can modify the pain meds that you are taking. Okay, so some more tips that you can do. Food. Okay, food is really very important because you're going to eat anyway, 3 times a day. Might as well eat the healthy food. So what foods can help the pain and the lung cancer itself? Cruciferous vegetables, so that would be your broccoli, your cabbage, your cauliflower. So those foods have already been proven clinically, that it can stop the growth of cancer. Okay, especially lung cancer. But mind you, it cannot eliminate. Okay, it cannot make the cancer disappear. So you have to remember that you already have a stage 4 lung cancer. So it might be very difficult already. But what is important here is that it doesn't get worse than what it is anymore, and you maintain a good quality of life. Okay, so that's for me. Yep.
There's a follow-up comment from him because he mentioned that his wife is already finished with the pleural effusion and pleural effusion 3 weeks ago, and no more water or fluid in the lungs.
Wow.
Tube is already removed, and as per the bone scan, it's also clear. And
bone scan is clear. Oh wow,
that's really good.
Really good.
Thank you for as well. There you go. All right. This question is coming from our viewer in YouTube. All right, coming from Miss Rose.
Oh, from YouTube. Okay.
Yes. When chemotherapy kills bad cells, can this ruin the good cells in our bodies?
Okay, I'll answer first. Yes. Okay, yes. The answer is yes. Chemotherapy kills the cancer cells and the healthy cells. Okay, so that's why when patients are undergoing chemotherapy, it's very important not just to focus on, killing the cancer cells. It's also very important to focus on the good cells, no? So it's very important, okay? During your rest period, okay? Between cycles, there will be a rest period. During that rest period, you do everything that you can so to help your body recuperate so that your body is ready again for the next cycle. Okay, because anyway, if you're not healthy enough, the oncologist will not give you the next cycle. Okay, so that is very important.
In fact, here, Dr. Jimmy is with us. he really is one of the more innovative oncological surgeons. Dr. Jimmy is not only able to do surgery, he's also able to apply chemotherapy, and he doesn't just stop at chemotherapy. He even looks into how to strengthen a patient while they are undergoing chemotherapy. Dr. Jimmy, I remember the first time you used PPARs is because there was one patient who could not take chemotherapy anymore, right? And you wanted to strengthen that patient so that that patient can continue her course of chemotherapy.
Oh, yes, sir, Shayan, I remember it very clearly. My patient is actually a female patient with colorectal cancer, in particular a rectal cancer. No? The patient already underwent surgery, so she's having the adjuvant chemotherapy. So on her second cycle of chemotherapy, she told me that she do not want to continue the chemotherapy anymore because of the very bad experience, because of the chemotherapy side effects like vomiting, headache, weak body weakness, diarrhea, all of that. So that's just the time when Sir Emerson approached me in the clinic and introduced me to PPAR. So at first I was hesitant to try the product. I said it could be just herbal product. But then what will I use? It's safe naman, it's organic, it's FDA approved. So I accepted the free product given to me by Sir Emerson and tried it on my patient, on my colorectal patient. Then lo and behold, after the third cycle of chemotherapy, he said that there's a very big difference in her experience. Most of the side effects of chemotherapy were gone, so we were able to finish all the 12 sessions of chemotherapy.
So, to all the viewers who live in Metro Manila and also in Bulacan, if you're looking for an oncologist who is able to administer not only chemotherapy effectively, but also take care of all the side effects, drop us a note and we will refer you to Dr. Jimmy, right? Because many oncologists and surgeons only take care of the application of chemo, but they don't have many good protocols on how to lower or remove the side effects or the dangerous side effects of chemo. So if you're looking for an onco with a complete protocol, drop us a note and we will connect you up with Dr. Jimmy. And I think you'll be in the best possible care that you can find in Metro Manila and in Bulacan.
Thank you, doctors, and thank you, Sir Chai. All right, next question coming from Nandi Kaugmahan. Where is wearing mask due to COVID helps to protect us from lung cancer, and can they cause it because it prevents us from breathing fresh air?
Okay, I think this question is two parts. I will answer the first part already, which is no. Wearing masks will not cause lung cancer. Cancer is a result of lifestyle, of DNA. But I do want to ask both doctors. Dr. Jimmy has to wear surgical masks so often because he's a surgeon. And Dr. Johnson, as a lifestyle doctor, wearing masks, what are the drawbacks of wearing care of any complications from masks, like mask hygiene care? I know surgeons like Dr. Jimmy, you change your mask all the time. But civilians don't wear paper masks, we wear like cloth masks.
Cloth
right?
masks?
And I suspect that this is a breeding ground for bacteria. So comments from Dr. Johnson, I guess this is a lifestyle medicine doctor.
Okay. So masks. There are no detrimental effects on wearing masks. As long as there are breathable areas around. Okay? If what you are wearing is essentially like, a plastic bag drawn over your head, okay, then you'll die, okay? So there's no such mask in the market right now unless you want to go to space, okay? And another one, with regards to cloth masks, it can breed bacteria. Of course, you are breathing on it. Your saliva will be on it, all over it, okay? But it's just so simple. You just have to put it in the laundry, wash it with soap and water, and that's it. Okay? Then you can wear it again the following day.
So, is it advisable that cloth masks be washed every day?
Yes,
Or
of
can
course.
Or can
Yeah.
you wear it for 2 days without washing?
No, well, that will stink. Okay,
Okay,
so
it will stink.
you wash it every day, just like your clothes. You wash them every day. Okay, and you wear new clothes, fresh clothes every day.
So
Okay?
those who use cloth
Yeah.
masks like me, you should have at least 3 or 4, so that you can wash the other one and it is dry in the laundry. Anyway, most cloth masks dry very quickly.
Yeah.
All right, so won't get cancer from wearing masks.
Wearing mask, yeah.
Wearing masks
yeah.
won't protect you from cancer also, because you get cancer because of cellular mutation.
Yeah.
All right.
Well, here's the thing, no? It would, let's say for example, jeepney drivers, those who are working in industries, mining, those who are exposed in smoke.
Okay.
Then it is in your best interest to wear a mask, okay? Just so that you don't, so that to mitigate the amount of toxins
That you breathe.
that you breathe in. Because if you inhale those toxins, then you increase your risk for developing lung cancer. Okay?
I would like to ask Dr. Jimmy, as a surgeon, every day, how many masks do you go through? How often do you change your mask?
Usually, in my practice, I change my face mask every 4 hours.
Wow. Okay. Okay, guys, that's the standard. That's the standard. So for those of us like myself, I wear this cloth mask the whole day. By the end of the day, it's not very refreshing anymore. So you heard it right from Dr. Jimmy, who is a surgeon, who is the most, I guess, careful about his mask. So he changes his mask every 4 hours.
Yeah. I think it would be more than that if Dr. Jimmy is going through surgeries as well.
After every surgery,
After every surgery, you have to
my
change.
mask.
Yeah, you have to change.
Okay, so I think this is a big warning to all of us who are lazy and wear our cloth mask for like 4 days, 3 days without washing. Okay, it's not a good idea, all right? And I guess it could cause infection in your lungs if you are weak, if your mask is dirty and you're breathing in all this bacteria. Could it?
Not really the lungs, but the skin around your face.
All right.
You'll develop pimples, or what we call nowadays as maskne. Okay.
Okay, this is a relevant topic. Next question.
Okay, alright. Coming from Ms. Lilibe, alright. Is lung cancer curable po? Because a lot of people are hesitant to go for chemo and radiation. How can we pass that?
Maybe Doc Johnson
I think
first.
I have to answer that. Yes.
Yeah, go.
It depends on the stage of the lung cancer. Usually, stage 1 and stage 2 lung cancer are very much curable with surgery, and then afterwards, usually a combination of chemotherapy and radiotherapy. Stage 3 lung cancer is what we call borderline. So we're not really sure. It depends if the
Okay, we can see you now and we can hear you.
Oh, okay. Doc Jimmy cut off. There, he's back.
Okay.
Yeah. So again, it depends on the stage of the lung cancer. So it is curable if it's stage 1 or stage 2 lung cancer. So the usual modality of treatment is surgery followed by chemotherapy or radiotherapy, or sometimes no more additional adjuvant treatment if it's just stage 1 and very resectable with surgery. For stage 3 lung cancer, it depends. Usually, the first treatment is radiotherapy and chemotherapy. If it regresses in size or there's a reduction in size, it becomes resectable, then surgery will follow. Then it becomes curable. But if it will not respond to chemotherapy or radiotherapy, then the course of treatment will become palliative therapy. And for stage 4 lung cancer, of course, it is we know that lung cancer is very aggressive. So actually, the goal is just for palliation. It's stage 4 lung cancer.
Doc Johnson?
Yeah, I totally agree. Stage 1, stage 2, totally resectable. So with that alone, yeah. Okay, in principle here, no, lung cancer, if it's a tumor, okay? So for all, not just lung cancer, okay? You have to get it removed, okay? So don't be afraid, especially if it's in the early stages. Okay? Because if the headquarters, no, so to speak, of the tumor, of the cancer cells is already not there, then you reduce your chance of having getting it spread. But of course, there will be microscopic cells that might, get thrown off elsewhere while the surgeon is doing the surgery. That's why after the surgery, you go for chemo, you go for radiation therapy. Okay, so that is the purpose. Okay, to reduce the recurrence, to reduce the risk of recurrence. Okay.
Dr. Jensen, you brought up a point which I want to emphasize to all our viewers because, for many years I've been in the Let's Go Natural group, So sometimes in the Let's Go Natural group, we say we go for the surgery, but we don't want chemotherapy, right? Because surgery is sort of natural in the sense that you just cut the thing out. But chemotherapy, you put a drug into your body. But what Dr. Johnson said, and what is very important, what Dr. Jimmy talked about it during the discussion is very, very important. If you go for surgery but avoid the chemotherapy because you don't believe in chemotherapy, then you are just a moment. Okay. It's Dr. Jimmy. Okay. Then you are really exposing yourself to danger. Because as Dr. Johnson highlighted, when you do surgery, right, there's very likelihood that cells are being, cancer cells spread, right, because of the surgery. So you should go for your chemotherapy because that will sanitize or really clean out any cancer cells that have spread because of the protocol you're interacting with the cancer tumor. So don't just do one surgery and listen to your doctor halfway, I guess, right? So for example, if you go to Dr. Jimmy to do a surgery, I am sure he will give you preventive chemotherapy after that. But don't worry. So like you, 5 years ago, I would be like, no chemotherapy. But today I'm like, okay, give it to me because I know why I need it. Because now we also have a solution to manage the side effect of chemotherapy, and that's the PPAS protocol. So with the PPAS protocol, you can be confident to do your surgery and after surgery chemotherapy with confidence, and to know that you are protected and that you're doing the best thing that you can for your cancer. So I hope this is something all the viewers understand. It's not that Dr. Johnson, Dr. Jimmy and I are not pro-natural. Actually, Dr. Jimmy is very unique. His mentor is actually an integrative doctor. So from early days, he always understood the whole holistic approach. But we are also very realistic to say that if we can manage the side effects of chemotherapy, it is a very powerful tool for fighting cancer. So I would say that 5 years ago, I was like everyone. I would be hesitant about chemotherapy, but today I am very confident that go ahead and use this very powerful tool to kill your cancer tumor and cells, because we can protect you from the side effects.
Actually, sir, I just want to, I was reminded, and I just want to echo out what our viewer last time said, because she really appreciated the topics that we are discussing here, because she said that it was really backed by science, and she feels safe to listen to our doctors. And with having both Dr. Jamie and Dr. Jackson here, I'm sure some of our patients can really attest that their tandem, in a way, their tandem really works well with the idea and the prescription as well. Okay, coming from Ruben, what is your take on vaping instead of smoking? Do vaping cause lung cancer? Dr. Jackson first,
Yes, okay. Vaping is never a substitute for smoking. If you want to quit smoking, then stop it. Okay, you don't substitute something bad for another bad stuff. Okay, you don't do that. Okay, and of course, vaping doesn't only cause lung cancer. It also causes bladder cancer.
Oh,
yeah, bladder, urinary bladder.
So it's worse than Your cigarettes?
Not really worse, no. But I think it's as worse.
As
Yeah,
bad.
it's as bad. It's as bad as cigarette smoking. So nothing good comes out of vaping as well, because yeah, there are also a lot of toxins being generated in that device, no, which are carcinogenic.
I think the most dangerous thing about vaping is that it doesn't taste and smell
Bad. Yeah.
You know, when you
Doesn't
smell
take-
smoke,
correct,
cigarette
correct.
smoke, you know it's not good for you, but you're addicted, right?
Yes.
But when you vape, it's like candy. They have all these sweet flavors, right? Strawberry
Yes.
flavor. It's an illusion. Doc Jimmy, what about you as a surgeon? I mean, you know, I always see on the cigarettes it says General Surgeon Advisory: smoking causes
Photos,
cancer,
yeah.
right? Yeah. So as a surgeon, do you have any comments about vaping?
Actually, I heard before that there are some toxins that get released if you ignite the vape, the apparatus. Is that what you call it, the apparatus?
Yeah.
So it can also generate a toxin, and this toxin can also even being inhale, you know, even if you inhale just the smoke coming from the vape, it can also cause deleterious effect to your health, especially to your lungs.
Yeah, so there you go. So if your children or your husband is vaping, you know, especially I think the danger is the young people, because they have such cute bubblegum flavor and things like that. It really makes it harmless. It's not harmless. It's just as bad as smoking.
Yes, and one thing that can be more dangerous with vaping, no, because when you use not really odors, no, but smells which are, you know, really attractive. People
Sweet
might
smelling.
sweet smelling. People might get attracted to it and even, you know, like it. Okay,
Yeah.
so yeah, that's where
That's
the
worse,
danger comes
worse
in.
than cigarette.
Yes, yes. At least with cigarette smoking, you know
Yeah.
that it smells bad. So
Yeah, you
people
know,
will
if
be
you have a
more-
wife and who doesn't like you to smoke, when you smoke cigarettes, she can smell it on your shirt and you're in trouble, right? But if you vape a bubblegum flavor,
yeah, she might like it.
she
so-
might like
but
it, right?
it's not
So
good for her.
It's not good. It's not good. All right.
That's a great question. All right, another good question coming from Ms. Lorna Padua. What size of nodule can in the lungs can be considered as a cancer?
Yeah, Doc Jimmy, at what size normally do we detect lung cancer in the lungs?
Actually, if the question is what size is detectable?
No,
what
she's
size can be
asking-
considered cancer?
Considered as cancer.
Yeah.
It doesn't depend on the size, no? Whether it's 1 centimeter, 2 centimeter, if it's proven to be malignant by biopsy or by sometimes by the characteristic in radiologic imaging like CT scan or MRI, it can be considered cancer. So even if it's small size, it's cancer, it's proven.
So what's important, Doc Jimmy, is you must go for a biopsy. Am I correct?
Sometimes you need biopsy, but sometimes if it's by imaging, it already looks like cancer. Sometimes they will go direct to surgical procedure.
And I think we did a follow-up series on surgery, but Doc Jimmy, maybe right now I can ask you the question is, you know, most people think that, oh, if I have a tumor in my lungs, they're going to crack open my ribs and, you know, Maron's big saw to saw open my ribs and, you know, big surgery. But actually, when you do a lung surgery for like a lung cancer patient, how small is the incision? Do you even need to cut?
Yes, of course you have to cut, but now the trend now is doing minimally invasive surgery. So it's just a very small cut, and you use the intrathoracic camera and also small instruments to do the dissection inside the lung. So most of the time you do not need a very large incision. You do not need to crack open the ribs of the patient. So there are many modalities. We even have robotic surgery now. So there are many treatment options.
Doc Jimmy,
for lung
just for our viewers' understanding, when you say that it's a small incision, how small is the cut for a lung surgery?
It can be as small as 5 millimeters, so around 5 millimeter to 1 centimeter.
1 centimeter. That's the size of my fingernail. Oh,
Yes, yes.
that's so small. So to all the viewers, you know, if we always watch Korean dramas or whatever, it's very dramatic. No, it's only 1 centimeter. It can be so small. So we are misinformed, all right?
Or we're watching too much movies.
We are watching too much movies, too many medical dramas, right? So I hope that makes it. I hope that encourages you not to delay to go and meet an oncological surgeon like Dr. Jimmy if you have, for example, a malignant lung tumor, and that you will not be afraid to go for surgery. It's not about cracking open your ribs. It's just a small little cut. So thank God for all the advances in surgery. Yeah.
Thanks, doctor, and thanks for time. Okay. Just before we go to our next question, I'd like to read a very amazing comment here coming from Miss Cecilia de Guzman. Our dear Miss Cecilia, hello, thank you Dr. Jansen and Simply Nature sa walang sawang pag-monitor. I'm ending monitoring and care. I have no more, there's no more fluid in my lungs. Thank you and God bless to all of you.
Wow, thank goodness.
Thank you, Miss Cecil. All right. Coming from Reinbert, I've had TB as a child and pneumonia 5 years ago. Do I need to be scared for lung cancer? How do I have a regular checkup for my lungs and how often?
Okay, I'll answer that first. No, you don't have to be afraid of developing lung cancer. So even though if you've had a history of infection, no, previously, it's not necessary that you will develop lung cancer. Okay, if you develop, hopefully not, no, if you develop lung cancer, there's no connection between the previous infection and your present one. What's more important is, number one, is your lifestyle. Okay, are you a smoker? Are you exposed to secondhand smoke? What is your occupation? If you are someone who is exposed to smoke, especially if you're a chef, a cook probably, or if you are, outside, if you're a jeepney driver, if you are working in the construction, you're exposed to so much dust, then that would be a more significant risk factor. Okay, not really the TB. With infection, as long as you are already treated, the infection has resolved, then that's already okay. Of course, there will be scarring because of the infection, because that is, the damage that the bacteria dealt to the lung tissue. But that is already there. Okay, but it's not harmful. Okay, your lung function will not decrease. Okay, its function is still there. Okay, so you don't have to be afraid of that. Okay.
Then the next question, I guess, next part of the question is probably good for Dr. Jimmy to advise. For a person like Reinbert who is worried about how to check for lung cancer, what kind of scans should he go for and how often?
Yes, thank you very much. So Reinbert, actually, lung infection is not a risk factor to developing lung cancer, just like your tuberculosis and your pneumonia. If you're living a healthy lifestyle, so you don't need to be afraid. Also, if you're not exposed to any harmful toxins, and also like smoke, like pollution, you don't have to worry about developing lung cancer. Now about monitoring, there's really no cost-effective or suggested screening modality for lung cancer. You just have to watch out for the symptoms. Some of the symptoms that you have to watch out for are chronic cough, meaning you're coughing that does not go out. No. Also, if you have blood in your cough, if you have unexplained weight loss or prolonged tiredness, also chest pain, as well as hoarseness, those are some of the early symptoms of lung cancer. If you have those, you have to see a doctor, and your doctor will be the one to request for a test for you. Usually it's just a chest x-ray at first, and if there's a suspicious finding on the chest x-ray, usually a CT scan will be requested.
Dr. Jimmy, since you're a surgeon, many of your patients go for lots of x-rays before surgery. Is there a guideline how many x-rays can a person go for, or a person shouldn't go for too many x-rays within a year? Is there a general guideline? For people who are totally healthy, but maybe they are hypochondriacs, you know, they are always afraid. So they want to go for x-rays every 2 months or every quarter. Is there a guideline that, you know, you should not have more than 1 x-ray a year unless you have a good reason? Is there a guideline?
There's actually no guidelines, Sir Shan. Actually, a simple X-ray emits very little radiation as compared to other modalities like radiotherapy, which is used for the treatment of cancer. No? So, as you can see, for orthopedic patients, during their stay in a hospital, they usually have X-rays left and right. So at least 10 to 20 x-rays per admission.
Wow.
And nothing happens to them. Yes.
Okay, so that's good to know. So if a person is really worried about their lungs, they can go for a simple x-ray, right? And if you see spots in the x-ray, that's where you get to start to, what's that called? Investigate more. Okay, I saw a follow-up question by Jen. Husband does barbecue. So to Dr. Jansen and Dr. Jimmy, any advice? First, is it as bad as smoking? Does it contribute to lung cancer? I mean, this is not just a chef; it's a chef at the grill.
At the grill, yeah.
At the grill,
yes,
right?
Yes.
Yeah.
Yes. The answer is yes.
Oh.
You increase your risk for developing lung cancer when you are exposed to barbecue smoke as well. Although it is really very aromatic. Yeah. Okay. So that aromatic smell that you inhale or you smell, right? That you like, that is the carcinogen itself. Okay?
Yes, I remember reading somewhere that, you know, when fats are burned at too high a temperature, they start to become carcinogenic, even though they smell great.
That is not only the fats. It's more on the animal, the heme getting burned.
Oh, heme, all right.
Okay. So that is where it comes from. And then what you do, you eat. Okay. So when you red meat, right? When you burn it, okay, it's not just the fumes that is carcinogenic. Okay, it is also the meat itself. Okay, so that's why we have something in lifestyle medicine that because not all people can people would have to transition to a healthier and healthier diet. Okay, so it's not an overnight thing. So we have to compromise somewhere in the middle. Okay, so how do you prepare meat? I mean, I'm a person who really loves beef. How do you compromise with that kind of patient? Okay, the way we do it is, how do you prepare meat? Okay, you prepare meat by cooking it in wet heat. So you boil it,
stew.
Yes,
okay, like
you
stew.
don't fry it, you don't grill it, you don't try to I guess grill, no, or or fry it. Okay, so it would be like, imagine your shabu-shabu. Okay,
that would be
then you
healthier way to cook meat.
That is the healthier way to cook meat. But here's the thing: you don't drink the soup.
Oh.
Yes, because the carcinogens would now be in the soup.
Oh no, the Chinese love to boil their meats and bones for 8 hours, right? To get all the good stuff
Don't
out.
do that, okay? Because it's not just the meats, not just the animal protein, but also the animal fat. Animal fat is carcinogenic as well. So you have to be careful. But again, to answer the Jen's question, yes, you increase your risk for developing lung cancer, like smoking cigarettes, but not only lung cancer, nasopharyngeal cancer as well.
Oh.
And throat cancer and oral cancer. So everywhere, that from the nose to the lungs, each tissue that fume passes through can develop cancer.
I'm sure Jen is worried right now. So the big question in her mind is, what can her husband do? Will wearing a mask help?
Yes.
And if the husband wears a mask, first thing I think of is the husband should wear a mask like Dr. Jimmy.
Yes.
like every 4 hours.
You have to change.
You know, you
Yes.
can't wear the same mask because the fumes will be in the mask. Then you are smelling it very close.
Yes,
Yeah.
yes, you have to change. Anyway, and it's also very, what do you call that? It's really warm inside the kitchen.
Yeah.
So you would sweat a lot with that mask on, and then of course you are really very
breathing
you're
as well.
moving about. Your breathing will be elevated because you're moving around. So yeah, it would be more difficult also for you to breathe, to inhale and exhale. So you have to change your mask every now and then. But at this point, I would suggest for you to wear the surgical mask, not the cloth mask.
Okay, not cloth mask. I was about to ask maybe buy 6 cloth
By
mask.
6 cloth mask.
Okay,
cloth
so
mask,
it's really surgical mask.
Surgical mask. So you once 4 hours have passed, you throw it.
So every 4 hours or every 2 hours, something like that.
Every 4 would be okay.
Every four
Every
would be
4
okay.
would be okay.
Okay, so to Jen, that will mean an added cost for her husband's business, but as you heard it from our doctors, it's as bad as smoking, and it's not just lung cancer, it's all the other cancers as
Yeah,
well.
I remember we've had this was a chef. Before the pandemic, we were conducting in-person seminars like this, no? But it's just in person, no? Or face to face. I remember we've had one audience who is a chef who developed nasopharyngeal cancer, nose cancer. Yeah, I think if I remember correctly, it was a she. Okay, it was a woman who developed one. So yeah, there you have it. So yeah, that is also an occupational risk factor for anyone who works inside the kitchen.
Yeah, all the more for someone barbecuing. Okay.
Yeah.
Dr. Jimmy, do you have any patients who came to you with like lung complications because they were in the food industry?
Yeah, many of those patients, many of those colorectal patients I have a history of being fun eating meat, especially grilled meat.
Grilled meat.
Yeah, so I think it's really a risk factor to developing colorectal cancer.
Wow. Okay, so there you hear it straight from the surgeon's mouth. All right. So okay. Wow. That I'm sure Jen tonight is gonna have a talk with her husband. All right.
Another wife is asking about her husband who has colon cancer. He is on colostomy bag right now, and recently it was expelling jelly red blood, but now it's expelling colored chocolate. What does it mean?
Okay. I leave this to the doctors.
Doctor, okay,
If it's brown color, it's a natural color of the feces. But if it's darker, like it's like a coal dark, dark curry color, and it could be black. No? There could be still be bleeding inside the colon. So I cannot really answer you without seeing the feces. What's the status of her husband? Was the patient already post-surgical, or is the patient having chemotherapy right now?
The only another follow-up information which she gave is her husband is already on PPARS. He started on PPARS family already.
Yeah.
So Miss Burge, if you can follow up with us if your husband has already gone through chemotherapy, right? That would be okay. Another first, I guess we can move on to the next question first that we have here. All right. So, by the way, some of our inquirers tonight are asking where they can find our doctors. Don't worry, because we will get in touch with you definitely on how you can reach out to our Dr. Johnson and of course Dr. Jimmy.
Those of you who want to have an appointment with Dr. Jimmy or Dr. Johnson, simply just type or private message Sheila that you want an appointment, all right? And they will arrange an appointment for you.
The person who asked about the nodule size a while ago, Miss Lorna, is now asking what is PPARS?
Okay, Miss Lorna, PPARS is basically a natural extract that Simply Nature produces. That's a big question. Okay, but I will try to answer it simply. Okay, in reference to cancer treatment, all right. PPARs basically it triggers your body at a cellular level, at a DNA level actually, to activate the pathways in your body that control and regulate inflammation, immune response, as well as metabolic functions. All these are critical to your fight against cancer. So PPARs, if you're going for all natural, for example, because you're old and you don't want to go for any invasive or chemotherapy because your body cannot take it, for example, then PPARs is like your best basic option. On top of that, you can always do other protocols, but I would definitely advise that PPAR be your basic one, because it's food grade, so there's no contraindication with any medication that you're taking, and it's really very, very effective. Many of our doctors who try to treat patients naturally use PPAR as like a multiplier and a foundation, right? And obviously, if you're going to go for chemo and surgery, PPARs is your best prep. It gets you ready for operations by helping you with your metabolic syndromes. All right, it helps with the recovery very quickly. Especially, after talking to Dr. Johnson, when we talk about the actual rehabilitation, for example, of your immune system, PPAR actually promotes cellular delineation. So that means your bone marrow producing blood will most likely produce better red blood cells and white blood cell count. And this is actually seen in patients. I have many personal friends who are patients whose red blood cell count and white blood cell count when they start chemotherapy actually start dropping. Okay, that's because that's one of the side effects affecting the bone marrow cell. The moment they get onto the liquid PPAR, their red blood cell count and the white blood cell count starts to go up back to normal, which the oncologist is very happy, because if the red blood cell count keeps dropping, then they are restricted. They find it, they cannot administer the chemotherapy, right? So this is a great complement. So if you're going to go for surgery, chemotherapy, this is something you really have to get an appointment with Dr. Jimmy or Dr. Johnson and find out more how to integrate into your protocol. Okay, and of course, you are looking for a chemotherapy person to administer chemotherapy to you. If you're in Metro Manila or Bulacan, just drop in and we'll connect you up with Dr. Jimmy. Yeah, because again, I really want to encourage, because I've one thing I like about Dr. Jimmy is that he not only administers surgery and chemotherapy, he knows how to keep you strong, keep you strong throughout that process. And that's something not every onco knows how to do. So that's why I give my very strong endorsement for Dr. Jimmy.
Thank you, Shan. Thank you, doctors. Coming from Ms. Kesha Ruben. Hi, Doc. I was taught of a traditional way to clear phlegm in my lungs and nose, which is suog, where you inhale vapor from water with salt. Is that safe? Is
Okay.
suog safe?
Suob.
It's very common here in the Philippines.
Okay. Let's go back to a little bit high school science here, okay? If you are inhaling the vapor, why are you putting in salt? I mean, essentially, what you're inhaling is already the gas state of water. So what you're inhaling is just plain water, okay? You don't have to put salt on the basin, because that won't really work anymore, okay? You leave the salt on the basin, okay? And inhaling water vapor, yeah, it can actually moisten the airways, so that if there are a lot of secretions or phlegm along inside the airway, that can actually somehow dilute it or make it easier to cough out. Okay, so it can help. It can help the symptoms. Okay, so suob, or water inhalation is mainly used because of the COVID pandemic. Okay, that's why it was really very popular. Now, suob or inhaling water does not cure you of the COVID. It does not kill the virus or the bacteria. It just makes your symptoms, it just
Makes you
relieves the
feel
symptoms.
comfortable.
It just makes you feel better. Okay? So it's similar to taking mucolytics, medications like mucolytics. So it breaks off the mucus, so it's easy to expectorate or easy to cough out. Okay, so it's just that. Okay? Yeah.
I see another question regarding smoking. Maybe Dr. Jimmy, since Dr. Jimmy also deals with lung cancer patients. Here it says, my partner started at a young age smoking and now at his 40s. Okay, there are two questions. I think one is, if he stops, will there be complication? I think this is actually quite a realistic question, you know, because I've noticed some people who smoke until they are 70, 80 years old,
Still living.
no lung cancer, no nothing. The moment they stop smoking,
They feel something.
and then they die. Okay. Dr. Jimmy, my mentor, the person who invented PPARs, right? He did tell me this. He said, if you cross 65 and you don't develop cancer, then you're probably okay. Yeah, so basically if you're smoking and you're older than 65, 70, maybe the answer is keep on smoking.
Keep on smoking.
You passed the stage where
Okay.
yeah, you're okay. But the question is, what about people in their 40s? Dr. Jimmy, any comments about this? Is it better to quit when you're in your 40s or continue smoking? I think for a 75-year-old, I will actually tell them, keep smoking long. You are already, because if you stop, the withdrawal might actually kill you. Yeah.
Actually, there's no age cut-off. Even if you're in your 70s, no, about 65 years old, you can still develop lung cancer. Actually, the risk of developing lung cancer, they say, is proportional to the number of cigarette sticks you smoke a day, as well as the number of years you're smoking. So if you can quit early, now that you're only in your 40s, you must quit unless you already have some form of nicotine addiction. So that's when if you suddenly stop smoking, that's when the withdrawal symptoms will appear. So in that case, the method that you should use in stopping smoking is the abrupt,
Gradual.
stage, gradual decrease in the number of cigarette sticks per day.
So for Wisha, the answer is a definitive yes. You know, encourage your partner to stop. You know, and if it's very difficult for him to go cold turkey because he's smoking many sticks a day right now, then as Doc Jimmy advised, gradually reduce it. You know, yeah. Doc, for quitting smoking, will nicotine patches and all this, are these?
Yes.
Will this help with the
This
addiction?
will help. Now, in lifestyle medicine, usually what we advise patients is to set a quit date. So it's an abrupt stop. But of course, we worry about withdrawal. So this is where the nicotine patches, the nicotine gum, varenicline, okay, or Champix if people are familiar with the brand. Yeah, it's varenicline. That is when they come in, okay. But of course, we have to manage as well the other side effects, because once you stop smoking, then some people will gain weight. Okay.
Oh, okay. So there are
Yes.
side effects to stopping
Yes,
an
there
addiction.
there are. Okay, so we have to be worried about that. But there are far more benefits in stopping smoking than the side effects that you have to worry about. Number one is your blood pressure. Blood pressure improves immediately after you stop smoking. And how fast do you notice? Okay, it's just a matter of hours. Okay, and you know the significant effect, the significant clinical effects that you will feel. Okay, it's a matter of days. So the benefit is really immediate. Okay, and yeah, in terms of developing lung cancer, it's better to stop early than later on. Okay, so the people that you see who are, you know, chronic smokers, old people, never had any health problems whatsoever, but they are, you know, they smoke like a pack a day. Okay, so these people are exceptions.
Yeah, genetic exceptions.
Okay, these are exceptions. If you take a look at the bigger population, there are far more people who dies because of cigarette smoking than people who,
Can
live
smoke
through it.
20 packs a day and live.
Who live through it. Okay? So, statistics wise, the chances are, if you stop smoking, it is in your favor. Okay? So, that's my answer to that question.
Yeah.
Okay?
I have one last story about quitting smoking. I realized one of my brother-in-laws actually quit smoking or smoked less because he got healthy. This is a really interesting strategy. Because he got healthy, he actually needed to clear his gout to pass his insurance medical exam.
Oh, okay.
All right, so he took PPARs, right, tablets. But in the process of taking the PPAR tablets, and he also, tried to live a better lifestyle because he needs to pass his medical exam for insurance, right? He actually ate more healthy, eat PPARs tablets, and you know what? I think his lungs started to clear up.
Yes.
And when he starts smoking, he starts coughing.
Yeah, it can do that.
Yeah, because he's healthier now. He starts coughing, and then he smoked less because it's no longer as easy to smoke. He's not. So interestingly enough, if you get healthier, you might find that you will quit smoking more naturally.
That was a good motivation for him.
Yeah. And he also found that he after taking PPARs, his liver got healthier.
Yeah.
He needed less alcohol to get what he wanted. And he also cut down his alcohol intake. So give your husband PPAR tablets, makes him a better husband. Okay, that's just a slight joke over
In
there.
other words, sir, quitting smoking is not only good for the body but also good for nature.
Yeah, correct. So basically, I think the idea is once you get healthier, your body wants to be healthier and healthier, and it's very natural. So this is I blame Dr. Johnson, right? Because I eat with him, I have to eat vegetables. The more I eat with him, the more easy it is to eat vegetables. It's like the healthier you become, you don't want to take the wrong stuff anymore, right? Yeah, right, Doc
People are
Jimmy.
starting to blame you, though.
I think it's so difficult for Doc Jimmy to eat healthy because he works so hard. So hard.
Just before the next question, someone is greeting Doc Jimmy Catapia.
Oh.
Rinses Falsesso. Good to see you.
Wow. Wow,
I'm fine.
Doc, you have fans. You have fan base. Okay.
Next question from Miss Lilibet. Doc, can secondhand smoking can cause lung cancer? Doc, I have a follow-up question on this because I remember my friend's dad is a jeepney driver and her mom was a housewife. However, it was the mom who got the lung cancer. Was it because of the secondhand smoking? Secondhand type of investment?
Okay, I'll answer. Yeah, most likely it came from the secondhand smoking because yes, you're essentially inhaling the same smoke. Okay, but there are also lung cancer patients, who do not have any history of smoking. There are also that group of people. Most likely it is because of genetics already. Okay, yeah.
Yes, Sheila. Next question.
Yeah.
Okay, next question. Okay. My cousin just passed away from bone cancer. How can I ensure that my family members and I won't get cancer?
Well, that is essentially you have to live a healthy lifestyle. Okay, so that is how you prevent it. Number 1, plant-based diet. Number 2, you have to exercise. Number 3, sleep well. Okay, 7 hours, not less. Okay, and that is 7 hours straight at least. Okay. Number 4, smoking. You don't stop smoking. Okay, if any one of you are smoking, or if someone is exposed to smoke, I mean occupationally, then that is when you should be more proactive in the other aspects of your lifestyle. Okay, so if, let's say for example, if you're a chef, there's no way you cannot inhale fumes, then you yourself, you have to go on a predominantly plant-based diet, okay, then you have to exercise as well. Okay, so in that sense, okay, so yeah, that is my answer to your question.
Thank you, Dr. Johnson. Alright, for our VIPs, please be excited because Dr. Johnson will be tackling about proper exercise, whether you can take strenuous exercises or not, okay, and specific conditions. Okay, alright, coming from the Ganti Umahan, do you have any outlet here in or person to refer here in Butuan City for cancer cases?
Where is Batuan?
Butuan.
I think it's in Visayas area.
Yeah, it's in.
Oh, okay.
Don't worry, we'll get in touch with you
Yeah.
right after the program.
Okay.
Another question from Mr. Bato Rosas. My wife has no lump on her breast. However, she feels something odd on the left side. Is this an early stage cancer sign?
Dr. Jimmy, how would you advise this husband who's worried for his wife?
My personal advice is to go see a doctor. Go to your trusted doctor. Go to your trusted doctor. Because breast lump or tumor can be benign, it can also be malignant. It depends on the age. For younger patients, less than 30 years old, the majority of breast tumors are benign. For those who are about 30 years old, the majority or the number of malignant cases of breast of the breast increases. So you have to see a doctor. Most of the time, the doctor will request for an ultrasound of the breast or mammogram of the breast. If there's something suspicious on the imaging, he or she might recommend you to have a biopsy.
You know, yeah, I wanna just echo what Dr. Jimmy said. You know, after doing these programs with Dr. Jimmy and Dr. Johnson, it has changed the way I look at my health too. You know, so just recently I just told Dr. Johnson, right? I don't have a fever, but I feel warm. You know, anybody out there who is like that, you feel like warm. Warmer than usual. My wife said that my face looks a bit flush, right? So immediately, based on everything that we've learned from our wonderful panelists, right, and our own research, I knew that very likely I'm experiencing inflammation. So there is likely that I may have a infection that has not reached fever level yet. So immediately, what I did, because I remember talking to Dr. Jimmy and Dr. Johnson, we do blood tests and diagnostics so that we know what to do next. So straight away, I went to High Precision, the nearest High Precision near me. I got myself a CBC and a urine test, right? And that cost me 400 pesos. You know, it's not expensive at all. And I was wondering, why would anyone try to save this money and later when the illness gets serious, you spend thousands of pesos, right? So yeah, 400 pesos, and lo and behold, really, it looked like I had a minor infection. Mm-hmm. So I was talking to Dr. Johnson, and he was looking at it, and he said, maybe you might want to consider to go for ultrasound. Then I remember Dr. Jimmy telling me about when you are close to 50 years old, you have to go and do a prostate test. Alright, I'm 48 years old. I keep hearing on my left side is Dr. Johnson, on my right side Dr. Jimmy, everything that they said to me. So immediately when I went to arrange for ultrasound for prostate, kidney and liver, mine as well. Okay, and I told Dr. Johnson, since I'm about 50 and we talk about cancer all the time, that's always like, you know, that's the problem when you talk about cancer all the time, you become very sensitive to this topic. So I told him, recommend me a urologist. I might as well go and ask all the questions and learn everything about urinary infection and everything, you know. So that's what I did. So even this morning, I went for a appointment with a urologist. I did my CBC. It cost 400 pesos. That's all it did, and it gave me the peace of mind. So as what Dr. Jimmy has suggested to you, go and see a doctor and also learn. Ask the doctor some questions so that you also know what you're going through, and that you don't need to scare yourself and you understand the process. All right, yeah. You know, hopefully by watching lots of Simply Healed, you are almost a doctor by osmosis. The knowledge just pour into you because you listen to so much. All right, but these are very useful things that we're sharing with you. I really want to thank Dr. Jimmy and Dr. Johnson for sharing all these things, and I am also practicing what I've been learning from them. You know, and it's just makes me very confident about how to handle my health.
Actually, Sir Sean, you'll be very pleased because some of our patients actually told me that they are sharing what they are learning here to their fellow patients. So, very good. Thank you for doing that as well. Okay. Coming from Ms. Lilibeth, Doc, what again are the foods that we should be eating while on chemo treatment?
While on chemo, okay, plant foods, okay? All plant foods, so there's no limit to them. Fruits, vegetables, whole grains, and legumes. Okay, so eat whichever is delicious for you. But there are foods, certain foods which are more superior when it comes to cancer. Okay, so the number one is cruciferous vegetables, especially for lung cancer.
What is cruciferous vegetables?
It's a group of vegetables. It's a group of vegetables, no. And one of the some examples, more specific examples, are broccoli, cauliflower, cabbage. So these vegetables doesn't really have a stem. Okay. So yeah, broccoli is a flower. Cabbage, cabbage is I think it's a flower as well. And then cauliflower is a flower. So those kinds of vegetables. Another one is what we call allium vegetables. Okay, so allium vegetables are garlic, onions. Those are really good as well. Turmeric as well. Okay, spices. All kinds of spices. Okay, so don't limit yourselves to just a select few. But when it comes to cancer not located anywhere along the gastrointestinal tract, okay, you have to add pepper to turmeric because the active ingredient of turmeric, or curcumin is not readily absorbable by the intestine. You have to add pepper there so that it can be absorbed. I don't know why. It's just that it's what scientists have observed. Okay, so for colon cancer, then don't add pepper to your food. Plain turmeric, then the curcumin will slide through your gastrointestinal tract and bathe the polyps and the cancer itself. Okay, so those are just some. Mushrooms as well. Mushrooms are really good too, especially to enhance or stimulate your immune system. What else? Simply Nature pea pears. Okay, Simply Nature pea pears is food. It's made out of a microalgae, so that is one of the superfoods as well. What else? Berries. Those foods. There are so many. You have to go for a consult, so I can give you the full list. There are so many. Okay, yeah.
Thank you.
I saw a follow-up question by Wersha again. As a second-hand smoker and my mother-in-law is also exposed, is it a higher chance to develop lung cancer? The answer is obviously yes. But you know, Dr. Jimmy had earlier already said, you know, just because you are a second-hand smoker and you're exposed to second-hand smoke doesn't mean that you will develop lung cancer. So it's just important, don't scare yourself unless you have the symptoms. For example, a persistent cough that does not go away. All right, just as Dr. Jimmy said, or if you cough up blood, right? Things like that. So don't be. I know tonight. Don't go and beat up your husband just because he smokes. Okay, and say that you are giving me lung cancer. Okay, relax. Okay, if you have other symptoms, then just go and see a doctor, and he will probably arrange for a simple X-ray, which again is very cheap now. And then you will be clear of mind. If there's nothing there, then you are perfectly safe. All right, and then you just go and treat whatever symptoms you may have. So yeah, basically the advice is go take some action. Instead of sitting at home and
Yes.
worrying, just go take a simple action. It won't cost you more than a few hundred pesos. And at least after that, you will have peace of mind.
All right. Okay. I just want sir to answer the next question here because someone is asking how to become a VIP. All right. We have an upcoming VIP meetup this coming September 14, and this is open for our PPAR users or Simply Nature PPAR users already. So please do message us if you are already taking PPARs so we can tell you and share with you the process and how you can become a VIP here in Simply Nature. So you can attend a very special event here. Alright, it's really exciting event that we conduct here in Simply Nature, most specifically and especially only for our VIPs. So be one and join us. Alright, Ms. Rasha is saying thank you to our doctor speakers, and I guess this would be our last question.
Oh, last question. Yes, all right.
Yes, for our questions we weren't able to answer today, don't worry, we'll get in touch with you after the program. All right, Miss Lorna said, I just had my colon surgery because appendiceal adenocarcinoma, which is still in the very early stage. I'm interested with PPAR, so please tell us where, how can we avail, oh, okay, how much is the powder and how much is the powder extract. I think maybe we would like to share to this patient the protocol that we usually do for cancer patients.
Right. So those of you who are interested in getting the product, there are two options you can go for. Simply indicate that you're interested. We can either connect you up with Dr. Johnson or Dr. Jimmy, and you can actually purchase the PPARs through them because Simply Nature distributes through our doctors. All right. Or if you just want to get it, then Sheila can service you. All right. So yeah, that's all right. That's the last question, right? Yeah, because I just want to thank everybody. I want to thank Dr. Jimmy. You know, it's so good. And we have another one coming up, right? I think we did a special just on surgery. Because of doing this lung program, I had so many questions about surgery, you know. And we did a special, a very short one, where I asked Dr. Jimmy every question that you can think of about going for surgery. So that's coming up pretty soon. And again, for those of you who have loved ones who are looking for a good surgeon, and especially for cancer, and because with cancer, you do your surgical procedure to remove the tumor. After that, you will also do chemotherapy most of the time, you know, to sanitize any cancer cells that might be floating around, right? And so I would like to recommend those of you who are in Metro Manila and Bulacan we can connect you up to Dr. Jimmy because he is one of the few oncologists that not only take care of the chemotherapy, he also takes care of managing the side effects of the chemotherapy. And I think that's something very comforting to patients. And for those of you who already have your own oncos and you are going through chemotherapy, then we'll connect you up to Dr. Johnson, who will be able to support you through your chemotherapy, whoever your onco may be. So, parting words, Doc Jimmy, then Doc Johnson. Yeah,
Okay.
your last words of encouragement, Doc Jimmy.
Dr. Jimmy.
First of all, thank you very much, Sir Shaya, Doc Johnson. Even if I'm one of the panelists, I'm learning a lot from you guys. Actually,
We're always learning from one another. Yeah.
yes. Okay. To everyone who are here tonight watching this webinar, thank you very much. Don't forget to always see your doctor whenever you have symptoms of lung cancer, like what I and Sir Shine mentioned before, and also always live a healthy lifestyle. So,
Okay.
Johnson?
Yeah, I also want to thank Doc Jimmy for being here with us. I also learned a lot from you tonight. Okay, yeah. To our patients, I know lung cancer is not just it's not just cancer per se, but it is also a lifestyle disease. And if it is lifestyle, I always tell my patient, if it is a lifestyle disease, okay, then this is modifiable. Okay, what does modifiable mean? Whether you have it or not, it is entirely within your control.
Wow,
Okay?
that's very important
Okay.
understanding.
Yes, there are a lot of things that you can do. Although if you have a family history of this disease, no, of cancer, there are a lot of things that you can do that to lower that risk. Okay, so yeah, to bring this into perspective, no, by risk. What I mean there is chance. Okay, so even if you are exposed to smoke, you are living an unhealthy lifestyle and all this, no, you increase your risk. That means you increase your chances. Okay? And similarly, if you live a healthy lifestyle, you try to avoid these carcinogens, you decrease your risk as well. Okay? But then again, it is not still 100% to put a 0% risk, okay? Because there are people who still develop cancer even if, they live healthily. But in the off chance that you develop one, at least you know in yourself that it is not your fault, okay, that caused you this illness.
Yeah.
Okay? Okay, so then you can say that, okay, probably this is the will of the Lord. Okay, the Lord wants you to, the Lord has a mission for you. That's why He put you through this ordeal, through this challenge. But yeah, you just have to be faithful that there's always light at the end of the tunnel. Okay, even if you are undergoing chemotherapy, you are really very weak right now. Okay, there's always hope. Okay, so focus on the positive. Okay, it's not just when it comes to, I'm talking already palliative care here, but don't just focus on the challenges that you are going through, but focus more on the positive. Okay, so yeah, that would be for me.
Okay, I have a second last words.
Okay.
Okay, because I still see questions coming up. My dad died of lung cancer. Is there a chance I can inherit it? And then people are always asking, what can I do to prevent myself from getting cancer? And I think this is related to a question by, I think, one of the viewers.
Yes.
Is PPARs only for cancer patients? So here is the short answer to all these questions. If you have a history, or if you're in occupation, or if you have chance, you are high risk or higher risk to get cancer, that is something you can do. All right, number one, lead a healthier lifestyle. However, that may not be easy to do. For example, Jen, whose husband's business is to barbecue meat, right? So what you can do is to take preventive measures. And I want to just share with you that taking Simply Nature PPAR tablets, it not only deals with lowering your chance of getting cancer by strengthening your immune system, right? It also manages your metabolic syndromes, high blood cholesterol, high blood pressure. So instead of taking multivites, I really want to encourage everybody, this is probably the best basic supplement you can take. All right, I've been taking it since I was 27 years old, and I'm 48 years old this year. So I've been taking it for 11 years.
Yes.
All right. No, not 11 years. 21 years.
Decades, yes.
I've been taking it for 21 years. All right. So I'm a good testimony for anti-aging. Hopefully, I don't look 48. Okay. And that's what you can do. So for all those who are asking questions about, will I inherit cancer? Instead of asking this question, the answer is definitely you have a higher chance. So what do we do now next? What do we do next? What you do next is take supplementation and then change your lifestyle. Why do I focus on supplementation? Because I have been there. It's very difficult. Not everybody is like Dr. Johnson, who can go vegan so dramatically. So along the way, most of us, it is more practical for all of us to take supplementation first, keep yourself healthy so that you have longer time to convert into a healthier lifestyle. All right, so that's my final advice, and yeah, that's it.
Thank you, sir.
See you guys next week, Thursday.
Yeah, see you guys.
Yes, talking about next week, our upcoming event for the next Thursday, August 11th, is entitled Breast Cancer, Uneffective Solution. contribution. That's with our dear Dr. Jansen Calalan as well. So we hope to see you once again, okay? Your stories of success stories and experiences with PPARs, amazing feedbacks is what keeps us going here in Simply Nature. And we are very thankful for all of you who joined us once again. I'm sure that you have been encouraged and you have learned a lot from tonight's discussion. We really hope to see you once again in our next webinars to come, because here in Simply Nature, we are always with you from start to finish. Thank you, everyone. Good night, and God bless you all.